Thank you for tuning in to our best practice series for medical providers working with refugee and immigrant youth and families. This is one video in a larger series hosted by the Trauma and Community Resilience Center at Boston Children's Hospital. Each short video will highlight experts in the fields of medicine and psychology who work with refugee and immigrant youth and families. We are grateful to SAMHSA and the National Child Traumatic Stress Network for their support in making the series happen. In this video, we'll be hearing from Marisol Granillo Arce and Sara Bayoumi-Smith, team members at Boston Medical Center. Marisol Granillo Arce is the lead medical case manager at the Immigrant Refugee Health Center at Boston Medical Center. She has over 15 years of experience working with immigrant communities in Los Angeles, California. In 2024, she moved to Boston to expand her work and continue supporting immigrant populations with vital medical and social services during times of urgent need. Her work is rooted in culturally responsive care, health equity, and a deep commitment to empowering underserved communities. Sara Bayoumi-Smith is a dedicated medical case manager with a passion for advocating for marginalized populations and health equity. Originally from Egypt, they bring lived experiences and cultural insight to their work, helping underserved communities navigate healthcare systems and access essential services. They have been working at the Immigrant and Refugee Health Center for 3.5 years in several roles and has specialized in outreach, providing emotional support, supporting patients in the community, and connecting patients to resources that support their overall well-being. And now it is my pleasure to turn it over to Marisol and Sara.
Thank you so much for that lovely introduction. And we are very thrilled and excited to be able to share our knowledge to all the different providers and the different audience that is going to be watching this. So for this series, we will get started with our learning objectives for this session. By the end of the presentation, participants should be able to explain the importance of supporting refugee and immigrant families in accessing healthcare and social services, identify key cultural, linguistic, and systematic barriers that impact access to resources for refugee and immigrant families, describe principles of trauma-informed care and their relevance when working with families from displaced or marginalized backgrounds, and recognize the role of cultural humility, language, access, and trust building in effective service delivery, as well as apply practical strategies to improve service navigation and engagement for refugee and immigrant families within their own practice. When it comes to health disparities and unmet needs, refugees and immigrant communities often experience significant health disparities compared to the general population. And these disparities, are limited access to preventive care and primary services, especially in healthcare system. We see higher rates of chronic conditions, such as diabetes, hypertension, that go sometimes undiagnosed and untreated, creating a higher burnout of medical cost, and also low utilization of mental health services despite high need. An example of that is a newly arrived family may avoid going to the doctor due to lack of insurance, transportation, mistrust, or fear of deportation, resulting in delayed diagnosis or emergency room reliance.
Complex and unfamiliar systems, navigating healthcare, public benefits, housing, education, and legal systems in the U.S. is difficult even for native-born residents. For immigrants and refugees, these systems can be language inaccessible, overwhelmingly bureaucratic, or lacking cultural relevance or sensitivity. Why does this work matter? Without guidance, families may fall through the cracks, missing out on services that they're eligible for or encountering discrimination or misinformation due to poor language accessibility to learn the available services. The impact of trauma and displacement. Many refugees and immigrants arrive in the US with a history of trauma, whether it's from war, persecution, family separation, or dangerous migration journeys. And this trauma can affect their physical and mental health. It can also influence how individuals engage with authority figures or service providers. And the trauma can also manifest as distrust, silence, or seemingly non-compliant behavior. The approach that we need is trauma-informed care and patience, not judgment, as those are essential to building trust and providing effective support.
And when it comes to social determinants of health, health is not just about clinical care. Social conditions like stable housing, employment and income, legal status, food security, education, and language access all impact a person's ability to live a healthy life. Refugee and immigrant families are disproportionately affected by inequities in these areas. Our role is supporting access to these social needs in healthcare and social service providers, not in a nice to have, not a in a way too nice to have, but it's a necessity and a human right.
Equity and human rights. At the heart of this work is commitment to equity, ensuring that all individuals, regardless of where they come from, have the opportunity to live with dignity, safety, respect, and health. Health is a human right. I'm going to say that again. Health is a human right. Immigration status should never determine whether someone gets care. Equity means addressing root causes, not just symptoms, and designing systems that are inclusive and not extractive. This is about justice and not charity. We're working to correct systematic inequities and create environments where refugee and immigrant families can thrive.
When it comes to considerations about the work that we do, we identify five important key considerations. The first one is cultural sensitivity. And why does this matter? Culture shapes how families understand health, illness, healing, parenting, and authority. Culturally insensitive approach can align families, lead to miscommunication, and decrease trust or engagement. And some key elements as well is language. The first step is in respect. Always prefer language and use professional interpreters. We should not have our colleagues interpret if they are not professionally trained. And traditions and beliefs, right? Some families rely on herbal remedies, traditional healers, or spiritual practices. So respecting, right, and learning how to work with some of those traditions and beliefs for our patients. And family structures, multi-generation households, collective decision-making, right? A lot of our families that we serve, they have that multi-generational approach, or gender roles may also affect or influence who participates in care. And some strategies when it comes to cultural sensitivity, ask open-ended questions. Such as, are there any practice or beliefs that are important to you in terms of your healthcare, ensuring that we're using cultural humility, acknowledge what do our patients know, and also avoid assumptions or stereotypes when it comes to culture, dynamic, and individuality.
Language access. Why does it matter? Without language access, families are excluded from informed decision-making, consent, and quality care. This leads to medical errors, confusion, and fear. The barriers may look like lack of interpreters, translated materials that are literal but not culturally adapted. Sometimes people use Google Translate and that just gives you the literal translation, and that just doesn't work. And then there's the over-reliance on children or untrained staff to interpret. The best practices are always use trained medical interpreters, whether in person or over the phone. Provide materials in the preferred language written at an accessible reading level. Hire bilingual staff or community health workers who reflect the community that they're working with. For example, a discharge instruction in English given to a non-English speaking patient puts them at risk of readmission or harm because they don't know what their follow-up is supposed to be and what they need to do to continue the care that they need. Navigating the complex systems, challenges that families may face are unfamiliarity with US systems and terminology, lack of clarity about eligibility for services, fear of immigration enforcement or public charge implications. The role that a case manager and navigator has is they translate not just language, but the systems. We help families apply for benefits, enroll in school, secure housing, or attend the appointments. We serve as a bridge between providers and communities. And some strategies are offering step-by-step guidance, visual aids, or timelines. You embed navigators within clinics or schools for seamless support, or partner with trusted community-based organizations.
And when it comes to trauma-informed care, understanding, right, like trauma and what does that mean for refugees and immigrants? A lot of the families that we serve, they have faced war, violence, family separation, detention, or lost. And these experiences shape how they interact with systems and providers. For example, right, something as small as like allowing the patient to be okay when you are entering the exam room and letting them know if it's okay to close their door, right? So again, being sensitive to that trauma that a lot of our patients are experiencing. Safety, physical and emotional, right, when it comes to being trauma-informed and providing care, allowing for trustworthiness and transparency when we are delivering services, and empowerment and choice, right? Giving our patients the autonomy to also be part of their care when they're in the exam room, and having cultural humility, right? Being curious about, the patients that are sitting in our exam room and how we are going to move forward and helping them and guiding them in providing care. What does this look like, you might be wondering? Well, in practice, avoid demanding personal histories up front. Let our patients share when they feel like they're ready to share something. I know sometimes as providers, we have an agenda when it comes to like, oh, I need to conduct my intake. I need to gather all this information, but being sensitive when we are gathering that information. Don't label people as refugee or whatever status, resident or not compliant, illegal, without exploring possible trauma responses. And be aware of triggers, right, such as uniform staff, closed doors, or clinical setting as well. And our last key consideration, which is building trust, why trust is fundamental. Without trust, the reality is that our families won't share their needs, follow through on the care plan or what they need to do in able to take care of themselves. And many come with mistrust due to prior trauma, systemic racism, or negative experiences with institutions. So we have to be we don't demand respect, right? We earn respect as we work with our patients. In some ways that we can build trust, be consistent and follow through on promises or referrals that you're doing, especially for us as medical case managers. It's crucial that we follow up and we're not just meeting with the patient and letting them know, oh yeah, I'll do this, and then we're not following up. Use warm handoffs, personally connecting them to the next provider or service person who's going to come and provide care. It's important. and share power by involving families in decisions about their care or support plan. We know that that is super important in a lot of the communities and a lot of the families, right, that we're serving, ensuring that we are involving the whole family if that is something that they prefer, and protect confidentiality, especially for undocumented individuals or mixed status families. It's really important. This is one of the things that we are constantly working as a hospital as well, ensuring that we are not putting things again, right, such as patient, it's illegal and can't access services. So being sensitive, right, even when we are documenting and maintaining our patients' confidentiality. And again, trust is built through not demand. Time and repeated positive interactions is important with our patients. Honesty about limitations and processes, being genuine and interest in the stories, right, that our patients have, and when they are coming for care, that they're sharing with us.
Radical integrated care models. The IRHC offers a multidisciplinary, co-located care model that breaks down traditional silos between services. It provides primary care, which is adult and pediatric providers with experience in global and immigrant health, behavioral health, which is embedded mental health clinicians who are trauma-informed and culturally responsive, OBGYN, integrated prenatal care for pregnant patients, including high-risk support for asylum-seeking or recently arrived individuals, medical case management, which is on-site case management who assist with housing, food, insurance, legal referrals, school enrollment, transportation, and public benefits, language and cultural support. Access to interpreters and multilingual staff with materials adapted to be culturally relevant and not just translated. Why does this work matter? Families don't have to navigate multiple systems alone. These services are centralized, coordinated, and trauma-informed, which drastically lowers barriers to care. Warm handoffs. Rather than simply referring to patients to other services and hoping they follow through, BMC's IRHC model uses warm handoffs, where providers personally introduce patients to a case manager or behavioral health provider during the medical visit. The connection is made in real time and in person, and if need be, over the phone or video call. And the patient then sees that these supports are a part of their care team and not a separate system. The impact that this has is that it builds immediate trust and rapport. It reduces the burden on the patient to follow up alone, and it increases the uptake of services like therapy, housing, help, or legal support.
And another practical strategy that has helped us at the Immigrant Refugee Health Center here at Boston Medical Center is ensuring that we have resources on site, and creating a shared digital resource guide to be able to share with any providers to ensure practice patients and staff can quickly connect to needed resources rather than sometimes waiting for someone to respond and get to you about a particular resource that the patient needs. On-site support, as medical case managers, we have medical case managers, social workers are available in the same clinic space, ensuring real-time problem solving. When it comes to like our digital resources, we continue to maintain and update our resources by the team, which this includes a number of resources that we've gathered, we compiled from immigration legal services, food pantries and meal sites, housing, shelters, mental health support, culturally specific community organizations, and more. And the benefit of having this is that frontline staff, again, they don't have to wait we also don't have to reinvent the wheel. There's a lot of resources that are already there. And how can we best support each other and work as a multidisciplinary team when resources are needed to be able to access accurate and trusted information that we can deliver. And our last practical strategy here is results and the impact of this. So again, this is very specific to the work that we do here at the Immigrant Refugee Health Center. But through our model, it provides, it has increased trust for patients, for staff, and also it has reduced the numbers of no-show rates. When patients feel supported and connected, they're more likely to return and stay engaged in care. Improve continuity, strong relationships with integrated providers lead to long-term engagement, even as families' circumstances change, as we've seen actually at the beginning of this year. And empowerment. Families learn how to navigate systems with guidance, building long-term stability and self-advocacy. And at the end of the day, as medical case managers, that is also one of our primary strategies for us, ensuring that we're able to empower our patients, not just letting them know this is what you need to do, X, Y, or Z. We're here to guide our patients, not here to tell them what they need to do. At the end of the day, they are the experts of their stories, and ensuring that they also feel empowered so that they're able to learn how to navigate the different resources that are available in their community. And here at the IRHC, we have a holistic community-based model, community-based social service model. And for us as the medical case management team, we're deeply knowledgeable about social service resources tailored to immigrant, refugee, and asylum-seeking patients that are available in the greater Boston area here. And some of the things that we provide information on is housing, food, transportation, public benefits, childcare services for elderly folks as well, support with healthcare access, coverage, medical debt, English classes, and more. And another very unique thing that we have here is, or we call it our in-house social services. And this is related to legal services, immigration. It's a legal immigration program that we have. It's called the Citizenship and Immigrant Rights Navigator Program. And this enables our patients to have access to trusted legal attorneys in the communities. And as well as another special area that we have, which is career development, right? Ensuring that our patients, once they are able to work in the country, they have that training and guidance on how to create financial sustainability for themselves, rather than feeling like they're continuing to depend on all these different social services program. So that is the way that we are creating financial freedom in a way. Another very unique and special in-house service that we have is our patient care fund, where we are able to tap into some of the funding that we funded through the year, through grants, through special donors, philanthropy, etc. We're able to allocate certain funds so that when some of our patients who have, for example, mass limited and they're not able to obtain a medical equipment such as a wheelchair, we're able to tap into those funds to be able to ensure that the patients continue to receive the proper care that they deserve.
The key takeaways, refugee and immigrant families face systematic barriers. These include language access, cultural dissonance, trauma, unfamiliar systems, and discrimination, all of which contribute to significant health and social disparities. Cultural humility and trauma-informed care are non-negotiable. Supporting families means acknowledging their lived experience, respecting their worldviews, and recognizing the trauma many carry. while actively working to reduce harm and rebuild trust. Integrated person-centered models work. Programs like BMC's Immigrant and Refugee Health Center show that warm handoffs, co-located services, and cultural responsive care significantly improve outcomes. Language access is foundational, not optional. Providing interpretation, translation, and bilingual staffing must be prioritized as a matter of equity, safety, and quality of care. Trust is built through consistency, partnership, and respect. Families will engage when providers and systems show up with authenticity. When they follow through and make space for their voices. And I'm going to leave us with some quotes today that I feel like reflect with everything going on. And the first being, every great dream begins with a dreamer. Always remember you have within you the strength, the patience, and the passion to reach for the stars to change the world. Harriet Tubman. And the next one is, the ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at times of challenge and controversy. Martin Luther King Jr.
And our last, so now that we've learned all this different information, right? How can we take all this knowledge and put it into action? So again, ensuring that practice cultural humility every day. Be curious about that. Ask open-ended questions about identity, beliefs, and practices, and avoid assuming and stay curious. Attend trainings or community events to deepen your understanding. Audit and improve language access in your spaces. Ensure your clinic or agency consistently uses trained interpreters, translated materials with cultural adaptation in mind, and being sensitive, right? Sometimes we assume that our patients know how to read and write, so ensuring that we are being mindful of those materials that we're disseminating. And advocate for hiring bilingual staff or community health workers, medical case managers from the population we serve, right? It's also very important that we are, as an organization, we are a reflection of the population that we also serve. Embedded trauma-informed approaches is also important. Assume trauma is present and respond with care. Create spaces that are safe, predictable, and welcoming. Offer choices and prioritize consent, especially in sensitive conversations. Build or strengthen referral networks. Identify trusted community partners for housing, food, legal aid, and mental health. Develop a shared resource guide and keep it updated so that you're able to have this readily available. Consider co-locating services or holding joint clinics with community organizations. Again, how can we best work as an interdisciplinary team? Use warm handoffs and follow up, right? It's important to follow up. Don't just give a referral, make it a connection. Walk families to the next provider when possible. Follow up to ensure they got what they needed. This builds trust and improves outcomes. And advocate for systematic change. Right now, we're living in some very challenging times. So for us as medical providers, folks who have more privilege and are in these spaces, it is our duty to ensure that we are advocating for the families that we serve, and ensure that we are pushing for policies that expand access to care regardless of immigration status. Promote funding for interpretation, culturally specific programs, and integrate care models. And just as a final thought, this work is just not about delivering services. I want to be mindful of that. It's about honoring humanity. Again, honoring humanity, shifting power, and working towards justice. This is what we're fighting against right now. Whether you're a clinician, social worker, community health partner watching this video, you have a role in making systems more inclusive, compassionate, and effective. To deny people their human rights is to challenge their very humanity. Thank you so much. And we have some resources for you. And these are some national resources.
Thank you, Marisol and Sara, for sharing your expertise with us. And we thank you all for watching. If you are interested in learning more, please visit our YouTube channel for more videos. The link is in the video description. Thank you very much.